Thank you for staying on Joy News Desk with me, Bernice Abu Baidun. The Nandom Theresa Hospital in the Upper West region is in dire need of medical facilities and infrastructure to cater for the increasing number of patients visiting the facility. The hospital currently has one operating theatre, and this has resulted in a first come, first served situation in conducting surgeries. Doctors have to queue to use the theatre. Medical Superintendent of the St. Theresa Hospital, Dr. Robert Amesia, at the climax of the hospital's Golden Jubilee celebration, appealed to government and other benevolent organizations to come to their aid. Here's a Rafiq Salam report from Nandom in the Upper West region.
The St. Theresa Hospital of Nandom first started as a maternity home and a dispensary in 1953 by the missionaries of Our Lady of Africa. Though their mission was to preach the word of God, the missionaries later realized that a particular disease called yaws was on the increase, prompting them to also take interest in the health of the people. The increasing number of patients to the center compelled the government in 1966 to approach the Bishop of the Ward Diocese to provide more and better infrastructure. Speaking at the climax of the Golden Jubilee celebrations of the hospital, Medical Superintendent of the St. Theresa Hospital, Dr. Robert Amesia, catalogued several achievements in its 50-year history. He noted that management with support and cooperation from the staff has over the years strived to outlive the challenges confronting them. However, the biggest challenge faced by the hospital now is the increasing number of orthopedic cases to the facility, which he wants the government to help complete an orthopedic center to ease congestion.
And with the orthopedic services too, it is not complete without rehabilitation. And with the rehabilitation, we need a physiotherapy unit, which has to do with space and then equipment. Even though we have physiotherapists, 4 of them posted by the Ghana Health Service to help in service delivery, the space and equipment is not available. So we need help in that area. The other area we need support is an additional operating theatre. Currently we have one operating theatre which has to see to emergencies for maternal health care, general surgeries, and then orthopedic surgeries. Because it is one, sometimes some people have to wait. Even though we have enough doctors that could have been doing surgeries, 4 surgeries concurrently. Sometimes you have to wait for one doctor to finish a case, then you do another case.
Dr. Robert then laid bare his future plans for the hospital.
We want this hospital to position itself in a manner that all the essential basic specialized services will be provided. So currently we have identified 3 medical officers who want to train in the areas of specialized services that most of the patients in Upper West region are referred to far places where they go with their relations and then with anxiety. So we are looking at areas of urology, then neurosurgery. There's already orthopedic surgery, but we're encouraging one of them to go and train and come and add up. And then we also need general internal medicine.
Deputy Upper West Regional Minister Hamidu Chinia Isaku assured management of the hospital of the government's commitment in helping the hospital realize its dream.
In order to strengthen the infrastructural needs of the hospital, the Nandom District Assembly and the outgoing Member of Parliament started the construction of orthopedic ward and theatre at the hospital at the cost of 292,270.64 Ghana cedis. And my information is that it has reached lintel level. All efforts will be made to complete the project in good time.
Reporting for Joy News, Rafiq Salam, Nandom.
The Director of Health in the Upper West region, Dr. Winfred Ofosu, has agreed to speak to us, but unfortunately we're able to establish him on the line now. We'll get to him for some updates later.